Welcome back. Dr. Bob Cassidy joins us every week, of course, on Tuesday to answer your medical questions. Of course, we've been sitting here talking about the weather.
Yes.
We could continue to do that, but I think it's more appropriate to get on with this medical discussion. Ask the doctor.
I think so. I think so.
Topic.
Yeah, so let's dive right in. We actually want to go to our first question. And it says, the past few times I've eaten eggs, my stomach has gotten very upset, but I've never had an issue before. Is it possible that I have developed an egg allergy?
So typically the most kind of classic symptoms of an allergy are going to be a rash, itchy skin, itchy eyes, maybe mouth swelling, and severe cases trouble breathing. So there can be more subtle symptoms of an allergy, like issues with your bowel, like upset stomach or diarrhea. So it's possible this could be an egg allergy, but the problem is when it's more subtle, it could be that something else is going on. Maybe you just had a stomach bug when you had eggs the last 2 times. So thankfully this isn't a severe type of allergy that there's going to be an immediate risk, so it's possibly something you could try eggs again. But in the future, sometime you might need to be tested if it keeps happening.
Well, that's so nice because you're so well versed with eggs because you just told us you bought some chickens.
You just told us that.
Did. Well, they don't lay eggs until they're 4 months old, so we have no eggs yet.
We cover a lot of territory on this
We can
couch.
come over and pick some up when that happens.
All right, our next question is from Kristen. She says it's a struggle to get her daughter to eat fruits and vegetables, and she doesn't like her vitamins either, of course. So any tips on getting that besides stuffing it down her face?
That's a bad move.
Yeah, don't want to do that. How can you encourage these kids to eat stuff like that? Come on.
Kristen, I think you're describing my children because this is a perennial problem for parents. So the first thing I would say is there's no immediate risk of like a severe vitamin deficiency, thankfully, because most of the cereals in our country, like pasta, rice, cereal, bread, are fortified with vitamins and minerals. So your daughter's probably getting the bare essentials that she needs. So then the question is, how do you get children to just eat fruits and vegetables, which is obviously better than getting fortified foods? And that's a tough thing to do, really. I would encourage you just to be patient. It'll get better with time. Try not to make it into something that's a battle because she'll probably win and it'll just be frustrating. So just make sure consistently you're putting good foods in front of your daughter, and then make sure she's not snacking between meals so that when she gets to dinner or lunch or whatever, she's hungry and more likely to eat those foods.
You know what I like to do too is just throw all my fruits and veggies into a smoothie.
Yep.
And honestly, it tastes so good, and you get spinach, celery, all that. Just throw it all in there.
Yeah,
I drink a lot of smoothies too.
Good idea.
Yeah.
All right.
I've been doing that lately.
Way to go, Melissa.
All right, our last question's from Cindy. She asks, what are some of the first signs of dementia, and how young can you develop it?
So dementia is usually going to involve some problem with your memory, and people can get dementia in like their 50s. Thankfully, though, that's very uncommon. But we get a lot of questions about memory problems because, let's just be honest, dementia's, it's a scary thing that people are worried about developing. But it's really tough to differentiate early signs just because there's a normal amount of memory loss as we age. And so the things that I look for to kind of tease out whether this is normal or maybe the start of dementia is whether families are actually bringing forward the concern rather than just the person, and then also looking for problems with like paying your bills or getting lost while you're driving a route that's familiar to you. But otherwise, forgetting names, dates, or appointments occasionally is okay.
Yeah, because I do that because when I'm tired.
I'm with you. It's very normal. It's very normal, which is good.
Well, in all seriousness, we always do have fun here behind the scenes.
Yeah.
But hey, if you have a question for Dr. Cassidy, you can leave a post on the 16 News Now Facebook page. Just search for WNDU. Dr. Cassidy joins us every Tuesday for Ask the Doctor segment. We'll be back.